Hello, my name is Professor Jane Coad, and I'm a Professor of Children and Family Nursing at Nottingham University and also Nottingham University Hospital NHS Trust. And I'm presenting today on this topic with a colleague of mine, Professor Faith Gibson, and she's also a Professor of Child Health, and she works at the University of Surrey and Great Ormond Street. And this is something that her and I have been working together for the last 6 months on, and it's around long COVID. And we're framing this as the next frontier in children's nursing. So the outline for this presentation is really to set the scene with you, to get us thinking about the impact of long COVID on caring for children and young people with complex needs, including those that are life limiting, from families and professionals' perspectives. And Faith and I have both spent a career, long career, working in this field. So we thought this was really important to talk to you today about. We've done some early consultation exercises, so I want to share those with you because there's a growing sense of consciousness around the impact of long COVID on this group. And then finally discuss that in terms of expanding research and service planning to include children and young people with complex needs and the impact on the families and professionals with long COVID. So let's just set the scene. None of us can say we have not been affected by COVID-19 in some way. Obviously, very differently. Some people, thousands and thousands of deaths, some people illnesses, some people lockdown. All of us have experienced that. What is now coming out is the emerging evidence and patient testimony is that there's a growing number of people who contracted COVID-19 and they cannot shake it off months after initially falling ill. There's a nice guideline scope which has come out, and I've put it in the reference at the end for you all, and that was in October. And it's saying that COVID is signs and symptoms more than 12 weeks. Although actually some people are reporting that much longer than 12 weeks to 5 months, 6 months, 7 months, much more than initially thought. And this is interesting, the exact number, and of course we don't know, experiencing long COVID is still unclear and it is set to rise. But there's an estimation of around 60,000 in the UK are experiencing it. So symptoms include things like brain fog, anxiety, high temperatures, all sorts of vague symptoms, post-viral stress, sleeping more, fatigued, including things like loss of taste, loss of smell. All of those things are going into this group. So let's just set the scene in our world of children and family nursing. The NIHR COVID report in 2020 reports that in terms of parents, children and young people, long COVID appears to be more frequent in women and in young children, including children, than might have been expected from acute 19 mortality. So they're saying the numbers are there, but they don't actually know how many yet. And that's, I guess, where Faith and I came in, because we realised about 6 months ago that although we had been considering children with acute COVID syndromes and families with COVID, we actually hadn't thought about the implications, or it appeared so, in the literature around long COVID. So setting the scene a bit further, we then started to uncover that families with children with complex needs and life-limiting conditions, and those are the ones that we're thinking on those continuing care packages, palliative care packages, neurodevelopmental conditions, neurodiverse cancers. They had been adversely affected by the pandemic and the resultant lockdown in terms of financial, emotional and physical. And so it followed that actually some of those families around which the child are adults will have been impacted by long COVID. It makes sense that if we're saying there's 60,000 people in the country have got this at least, then some of those are going to be the adults that care for this group of children and young people. And there is some literature that families are being left vulnerable. It's a massive change to their normal routine. So they have their normal packages around the child with complex needs, and suddenly one person is out of that what's known as the relational care network. In other words, the relations and the relationships that care for that child were disbalanced and disrupted. And so this was difficult to manage family life for these children and the families that care for the children around them with complex needs. And so they were navigating not only the pandemic, but they were navigating healthcare management. And many of the families reported that they felt isolated and forgotten. There's a marvellous report, and I've put it at the end of the reference list, by Anne-Sophie Darlington and Lorna Fraser. And they talk about being forgotten. The families feel forgotten and lost. And there's a lovely quote here that it feels like all the support we had just vanished overnight. These are really important words for us to think about as children's nurses. So added to that scenario, and this was after a few months of working in this area, Faith and I started to think it is the families, but it's also those that are caring for the families. So the multi-professional issues, the multidisciplinary team around those families were also experiencing long COVID. Staff were still off sick, long COVID issues, and shortage of staff. That's both in the acute settings and the community, where it was already stretched. So I've put some issues there for you around sickness, discharge, assessment, skills and team, and more, because we're saying more, Faith and I, because actually we don't currently know, but it is a consideration and it is an implication of long COVID. So where are we now? Gosh, well, what we do not know are what the numbers are and the impact of long COVID on those caring for children and young people with complex needs and life-limiting conditions in our health and social care settings, including hospices, hospitals, community, and areas like residential care, and all these issues that come into play when we're talking about children's nursing. We do not know those issues in terms of the family impact, as well as the multidisciplinary team impact. So Faith and I have set about undertaking a number of national consultation events with a number of senior colleagues. We've had conversations with 2 national charities that have got wonderful family groups, and we've undertaken 3 in-depth family interviews as well. From the families' perspectives, they said the same thing as they'd said in the Darlington work, that they felt isolated and the relational care, which I talked about earlier, was imbalanced. So family functioning was disrupted. Extended family members were reduced. In some cases, when we talked to the family groups, they said they'd actually lost a family member, like a grandma or granddad had died that normally helped with care. So that was an impact, as well as somebody in their family having long COVID who used to help, who could not now at this point help in the way that they had or support them in the way that they had. So parents and carers and children reported to us that they were having to cope alone with complex and chronic health needs, with a feeling of increased dependence on the services and the teams. So they were asking, but they didn't feel they were getting. Many families said that it was really difficult to get respite, and some of the assessment tools, they said, didn't take into account long COVID because they'd been developed beforehand. So families were left stressed, aiming to balance that care, especially if one partner had long COVID symptoms. And some families said to us in our national charity work is that they didn't actually like to tell the multidisciplinary team, the professionals, that they just got on with it and they were just about coping. And that's also concerning. I'm sure we all agree. So we also did a number of consultation events with children's nurses, with the Royal College of Nursing, children's nursing groups, and 2 professional networks. And we undertook an online meeting with 27 attending. And it was really interesting because of the 27, 22 senior nurses, senior children's nurses, informed us that they had issues within their service related to long COVID. So it's a hidden issue, we both felt, because of that. What they said to us was that there was a lack of understanding about long COVID in terms of adding this. And this is why it's so good to present today, for us to start thinking about this and adding this into our work. It was things around children waiting to go home that concerned us. There were 7 cases in the 27 attending at that event that I've mentioned, 7 cases that were waiting to be discharged and couldn't get home because there wasn't anyone to assess and there wasn't the right tools to assess the child. That's really concerning. There was lack of information in terms of the professional role, such as carers and support. There was lots on PPE, so the acute COVID issues, but not in terms of long COVID and how to support the families with the long COVID issues. And so that was interesting. There was quite a debate around support provision, that the services were impacted. So things, we're talking the multidisciplinary team here, physiotherapy, the speech and language therapists, the CAMs, all of those things, nursing, GP access, all of those professionals, there was impact of long COVID. But particularly what discussions we had was that there was a lack of consideration in the assessment tools being used and then the pathway decisions, because of course these assessment tools were made pre-COVID days. So we've drawn this to just conceptualize it. This is what we do not know. I'm not coming here with any answers because we have huge gaps in the literature and the research and the clinical practice. But we do know there is family impact. We know there's professional impact, and therefore there must be impact on the child and young people with complex needs of long COVID. So what's needed now? I think what's needed now is some good research. We need to explore the evidence to date, and we need to hear the stories of long COVID. We need to collate those metrics as well, and we need to understand the issues of long COVID implications on families and professionals in terms of children and young people with complex needs and their care. We do need to rethink and re-engage. We need to work together as a multidisciplinary team. There's a number of papers coming out saying that it's the multidisciplinary team that need to think about children, young people and families, rethink care in terms of assessment, planning and delivery, if we're going to move this forward. So just in conclusion, what I've tried to present, what Faith and I have been working on, is that long COVID has impacted on children and young people, families, carers, and multidisciplinary teams, but currently it's unknown how much. And we need to work together and adapt to look at that impact. And we need to consider it in our clinical practice, our education courses, our training and our research, if we are to reduce those inequalities and improve our health and social care services to be fit for the future. Thank you very much. The next slide is just some useful references that we've pulled out for you, and I hope that is very helpful. The final slide is just to say that any of you want to talk on any of these issues or send us your reflections, we would love to hear from you. So I've put both Faith and I, our emails there. Thank you very much for listening to this, and I hope it's been very useful.